right. Well, first responders put their life on the line every day, and in many cases, they face combative patients. Mallory West is here with more on how they stay safe. Mallory?
Jennifer, according to the National Library of Medicine, emergency medical service personnel are 22 times more likely to face occupational violence injuries than the average for all workers in the United States.
Assaults are a growing concern among Monroe first responders, and the rise of mental health patients have some worried.
But we're always concerned about safety. We've seen an increase in psych patients. Obviously, mental health is a big issue that we're combating.
The Quality Improvement Coordinator at Acadian Ambulance Service says the reason assault cases are low in our area is because staff is trained to be proactive instead of reactive.
Oftentimes communication, just talking them down, being soothing, calming, letting them know what's happening is very helpful. Sometimes that doesn't work though, and so we have a lot of safety protocols in place up to restraining patients, whether it be physically or chemically, just for their safety and ours. And we always make sure that we fully explain what's happening before we just do stuff.
Another thing Hardison says keeps staff safe: strength in numbers.
We are very mindful of scene safety, getting PD there to assist us, fire department first response for us as well.
When asked about safety, St. Francis Medical Center gave KNOE a statement saying, in part, when issues arise, they are dealt with appropriately and swiftly. We do not tolerate physical or verbal aggression or abuse towards staff, patients, family members, or visitors. Although first responders face many challenges, the love they have for their community helps them persevere.
The thing that keeps us coming to work is just knowing that we're making a difference, knowing that we're impacting our community in a positive way, knowing that if we didn't show up today, you know, that person that we helped may not have gotten what they need. So it just keeps us coming in.
First responders in Monroe tell me that they have been lucky and that facing combative patients rarely results in injury due to the safety measures that they take. Jennifer?